Younger people are getting COVID-19 boosters at significantly lower rates than older people, but new hospital data shows it's not causing a surge of sick patients in local emergency rooms.
Here to explain is Dr. Daniel Koritzkis, the chief of infectious diseases at the Brigham. Dr. Koritzkis, thanks for your time.
Good to see you, Ben and Erica.
All right, Dr. Koritzkis, this report uses patient data from 3 large health systems, 2 in New York, 1 in Israel. Does their information match what you're seeing at the Brigham?
I don't have age-specific data for the Brigham, but it certainly matches what we're seeing in the state. We know that hospitalizations are much, much higher for people age 80 and above, somewhat higher for people in their 70s, and very, very low for people who are younger than 60. So that's very much like the data that you've seen.
Okay, so let's take a closer look at who's getting boosted in Massachusetts, Dr. Koritzkis. So you can see all over 80% with the older age groups, but look at this, ages 16 to 19, they're at 55%, ages 20 to 29 at 49%, 30 to 39 at 55%. We know health officials would want to improve those rates, but if younger people don't really get that sick from COVID, do we need to worry so much about whether they are in fact boosted or not?
Well, I think that's an important question. And to be honest, we really just don't know. That was a big point of controversy at the recent FDA advisory panel hearings, exactly what to advise younger people. To paraphrase the old World War II song, someday we'll boost again, don't know how, don't know when. But people will need boosting at some point, but we honestly don't know how soon they'll need it.
I'm going to go off script here for a second. So is this a scenario, Dr. Koritzkis, because I know a lot of the information is still fluid, where you could see maybe a vaccine given to the youngest among us, kind of in that birth sequence, and then maybe nothing until they're older, like a shingles vaccine well down the road? We don't know yet, right?
Well, I think we'll have to see, is there a time at which younger people begin to start getting more seriously ill? And I think it's important to point out these have to be healthy young people. I wouldn't defer vaccination if you had a pre-existing condition that places you at greater risk for severe COVID, regardless of age.
Right. All good information. And a lot of this, of course, still coming in. And just one more thing, Dr. Koritzkis, when do you think we'll know about what they advise for this coming fall? In the next couple of months? Will it be not till summer? How soon would they get that out there and say, yes, when you go get your flu shot again in the fall, get a COVID booster?
I would expect information to be coming out later in the spring, around the same time that the decisions are made about which strains are going to go into the influenza vaccine. I think they'll try to make it one set of decisions about influenza and COVID vaccination.
Okay, something to be aware of.
Yeah.
Thank you, Dr. Daniel Koritzkis, as always, for joining us.
Very welcome.